Hi, I'm Jean Schumacher. I'm founder of Simply Plant Based, where I have a lot of programs to help you to change your health destiny, including most recently launched is the Pregnancy Advantage to help women get their bodies pregnant ready. Or if you're having trouble conceiving, we can help you there. And today I have Dr. Miriam Maisel, who is here with us today. She is certified lifestyle medicine physician and is licensed to practice hypnosis in Israel. And in 2018, she contributed a chapter on nutritional treatment of selected chronic diseases to the new medical textbook, Nutrition and Integrative Medicine, a primer for clinicians. So thank you so much, Dr. Maisel, for taking the time to be with us here today.
Thank you, Jean. Nice to see you.
Yes. Well, share with us your journey. How did you come to realize that plant-based living is where it's at?
Yeah, it was sort of a gradual thing, Jean. I became vegetarian when I was about 14 years old. There were a number of things that influenced me. I was reading, a little bit about yoga and practicing some yoga on my own. And then I came across this wonderful book, Diet for a Small Planet, which is a classic which talks about problem of world hunger and addressing world hunger through reducing consumption of animal products. Also showed that it is possible to obtain adequate protein and good quality protein without using meat. And at the time, there was the theory of combining different protein sources. Francis Moore-Lappé, who wrote the book, has since come out and said, we now realize that that's not really necessary. But at the time, that intrigued me and it gave me confidence. And then I actually met a peer, someone my age, who was vegetarian, and that also helped me realize that it's possible. And then one day I kind of found myself standing outside of a butcher shop and looking in and seeing all these body parts, hanging there. And I thought, okay, I really don't need to eat that. And I decided that I wasn't going to. So that was the beginning. And it was very unusual in those days. We're talking about the 1970s. And there were concerns about, I was supposed to still be growing, and there were concerns about would she grow and would she survive? And, she'll get over it.
Are you going to get enough protein? That's always the question.
Yeah. The concerns were not as specific as that, just, growth and survival were the main concerns. Anyway, I didn't get over it. I continued as a vegetarian for a long time, and not really with the idea that it was healthier. Nobody around me seemed to think that it was healthier. And there was more the concern about having enough iron. For example, people were worried about having enough iron in a vegetarian diet. And even when I trained later as a doctor, I felt that I was doing this because this was my feeling, this was how I wanted to eat, if I had the choice. Obviously, if you're in a starvation situation, you might make other decisions, but I felt happy with that decision. It wasn't until really the dawn of the internet, and I would say about 14 years ago or so, that I began to see things in the medical literature that pointed to health benefits of not having meat in your diet. The main influence that I came upon at that time, I very much liked the writings of Dr. Joel Fuhrman. And that was one of the gateways into the whole food plant-based direction for me. I did the course with T. Colin Campbell's eCornell, which is not clinical. I spent time at True North Health. And at the same time, kind of gradually, anyway, I was noticing that even though I would purchase dairy products at home, I didn't actually eat them. And I found that when I ate dairy products, the next day I would almost have like a hangover, like sinus, So I thought, okay, well, I guess I don't need that either. So that was about, I would say, about 12 years ago. And then I've gone on, qualified as a lifestyle medicine physician. The American College of Lifestyle Medicine is strongly in favor of a diet based on whole plant foods. In the beginning, I thought, okay, well, for heart health, this is certainly much better. But now we know so much more. There's a lot of documentation of benefit in autoimmune conditions. Dr. Ornish has a study relating to prostate cancer, where the group that used a whole food plant-based low-fat protocol had less. These were men who already had prostate cancer. They had less occurrence or progression of the prostate cancer. Dr. Neil Barnard has used a very similar protocol for diabetes. And, one seems to see more and more that the same basic eating pattern has many, many benefits.
It's so true. It's
Yeah.
so true. Well, when you did your medical training, did you receive any training in nutrition? Did you do it in Israel or in the United States?
No, I did it at Boston University School of
Okay.
Medicine, and then I did my residency at Brown at Providence.
Did you get any nutrition training?
I want to say that however much or however little training one would get in any area in medical school, doctors are and have to be lifelong learners. So before 2020, nobody had any training in coronavirus, right? Before the 1980s, nobody had any training in HIV. We had training as far as macronutrients and as far as deficiency diseases, which one would seldom see if one was living in a first world country, gross deficiency diseases. We didn't have training in whole food plant-based, it didn't even exist then as a term. But the fact that, a doctor may or may not have had training in nutrition. Dean Ornish didn't have training in nutrition when he trained either, and neither did Esselstyn, and neither did McDougall, and neither did Furman, certainly. So most of the doctors who have taken an interest and taken the time to learn about a whole food plant-based diet, they have done it outside of the specific framework of their medical school. What's different now is that the American College of Lifestyle Medicine, doing postgraduate physician education, they are in favor of a diet based on whole plant foods. And it says that, it says it right that's on the label, right on the label. So this gives legitimacy to this particular approach. But this is a very recent thing.
Well, you wrote this wonderful article in Health Science Magazine. And for anybody out there listening to this, Health Science Magazine comes from the National Health Association. And you wrote this wonderful article, Are We Listening? And the National Health Association has been promoting a whole food, plant-based, salt, oil, sugar-free diet lifestyle since 1948. So, wow. So congratulations on getting on the cover. So tell us about your article.
When I wrote that article, I was inspired by a recent, very large study that was presented in The Lancet, which is one of the top medical journals in the world. And the name of that study, the article anyway, is called Food in the Anthropocene. And what they show in that study is what diet would be suitable for humanity that would meet the definition of a healthy diet, but also be able to be produced sustainably within certain global parameters of water use and greenhouse gases and pollution and so on. And it really brought these fields of medicine, nutrition, and farming and environment all together. And when I advise individual patients, about their health concerns, I talk just about the health concerns. I don't talk about the environmental aspect, except to say that, if you do adopt a whole food plant-based diet, it's also very beneficial for the environment. But I really felt that the time has come. We have so much climate instability. We have, these big fires, floods and droughts in countries that then drive people to leave the lands on which they farm because they become unfarmable, and they get in little boats, and if they're lucky, they land somewhere, and if they're not lucky, they go down. Big fluxes of population movements that also can cause political instability, not only in the home country, but also abroad. We don't have an awful lot of time in which to repair the damage that has been done by the byproducts of the Industrial Revolution, which I don't think anyone really could have foreseen, 150 years ago or something.
Well, I think, within the planet itself, it's not to say that we haven't had global changes. We have. We've had 4 glacial epochs. I mean, we've had tropical times. Mm-hmm. Yeah, we've had changes on the planet, but I think this is the one that's the first time that it's been driven by man, by humans.
That's why it's called the Anthropocene. This is the age in which human activity has an overwhelming influence on the planet. Now, if humanity goes down, the planet will recover, but I don't think any of us wants to see humanity go down. We want to continue to, to live and love and thrive and so on. And hopefully that will be possible for a long time in the future. But anyway, this article spoke about, the challenges of sustaining a projected human population of, I think, 9 or 10 billion people in the year 2050, and what would need to be done in order for that to happen. There have been lone scientists trying to make a point about ecology. For example, Rachel Carson in Silent Spring, she is almost the founding mother of ecology. She is the person whose work inspired the bringing of ecological issues actually into Congress. And she died in her 50s of cancer. Had she lived, I think we would have heard a lot more from her. But she first wrote her book Silent Spring in the late 1950s or early 1960s, and looked in such fine detail about what happens in ecosystems when pesticides and herbicides and excessive fertilizers are used. And the agriculture industry looked upon these interventions only as successful interventions. They didn't look at the side effects. And so she was the first person who really pointed a finger at the side effects, and then there was Frances Moore Lappé, who wrote Diet for a Small Planet. That impacted maybe some people, but it didn't impact policy in the way that needs to happen. So there have been these voices out there who've spoken about the importance of humanity kind of becoming more aware of our influence on the environment and more aware of responsibility, not even if you don't want to say in a moral sense, but in the fact of recognizing that there are consequences that up until now maybe we were less aware of. And now we have Greta Thunberg, but she is standing on the shoulders of these giants, most definitely, So then the coronavirus appeared in our midst. And the coronavirus seems to have originated from the proximity of bat populations with a wet market animal business, selling animals for food, and where a lot of species are crowded together. We've had other epidemics like swine flu, we've had mad cow and so on, all these diseases which have come from the animal population. So, we haven't had a big pandemic like coronavirus since the so-called Spanish flu 100 years ago. But all the causes are there for us to have another pandemic if nothing changes. The features of all viruses have to do with their infectivity and their lethality. This coronavirus is relatively not that lethal. The original SARS virus killed about 1/3 of the people who got it. And there are other viruses lurking out there that are much more lethal. The original SARS virus was not that infective, however. Our coronavirus is very infective. I think we need much more awareness as to the causes,
Yes.
as to the origin.
If we could just get away from the animal products, I think that would help a lot on so many levels. Well, you completed a chapter from the textbook Nutrition and Integrative Medicine, a primer for clinicians. What was your chapter about, and how did you come to specialize in this area?
I chose to write about the core clinical researches that inform the whole food plant-based approach. And I felt that these are the things I would really want to hear about if I were a medical student today. I included researches of Dr. Ornish for reversing coronary artery disease, Dr. Esselstein on the same subject, Dr. Barnard to do with diabetes, Dr. Walter Kempner to do with hypertension, Dr. Swank, who did work on multiple sclerosis. I went through these studies and discussed how they were done and what the outcomes were and why they're important to us. And then based on that chapter, I actually have contributed also a lecture to a university course in the UK. The University of Winchester has a plant-based nutrition course. I contributed my lecture, which I've given in other contexts here and there, called Food, the First Medicine. So these were all clinical studies. They were not massively large studies with thousands of participants, but they were studies which demonstrated the potential of diet, the potential to use nutrition as the primary clinical tool.
Circling back to Roy Swank, I loved reading about his work because my husband has had MS and we've resolved it, because if you go to the MS website, they talk about how to live with MS. Well, we didn't want to live with MS. And so we don't. So he's gone plant-based and he's had no symptoms for a long time. So
people sometimes argue with these studies and say, well, it was only one study. And I say, yes, but Dr. Swank, he studied his patients for, can't remember if it was 35 or 45 years. So, if I had MS, I wouldn't sit around waiting for someone to repeat the study.
He had over 3,500 patients that he treated with food. And they did extremely well without drugs. Well done to him. What chronic issues do you see most in your practice?
Mostly people who've had a heart attack or who have cardiovascular risk factors. I see people who are vegans who don't quite know how to be healthy vegans, and somehow they find their way to me. I see people with autoimmune conditions. I'm a family practitioner, so, I can see anybody.
Yeah. So what are some of your favorite dishes?
Favorite dishes? Well, I cook very simply. I'm living here in the Middle East. We eat a lot of salad. So, I eat a lot of, usually one meal a day is a very big salad with a lot of raw vegetables in it. We have wonderful fresh raw vegetables right now. For a cooked meal on a regular day, usually I will steam seasonal vegetables, and either alongside with a baked potato or baked sweet potato, or steam the vegetables together with some grains that I've prepared previously. My salads always get some, beans on them. My favorite, you didn't ask me, but my favorite cooking tools, I have two favorite cooking tools. One is my sharp knife, and the other is just an old-fashioned pressure cooker.
The new version.
I know there are I've got one of those as well, but actually it's nice to have, but it's not really necessary. I will make a disclaimer. I don't really do smoothies. I like to see what I'm eating and taste what I'm eating and see the food. So I haven't joined the smoothie movement.
Okay.
I make a lot of soup.
Love
You know,
soup.
and my soups are basically about half vegetables and half beans of some
Yeah.
sort or other, beans or lentils. I mean, in the, volume wise, very flavorful.
What are 3 things someone can do to help them start on this journey?
Well, I think first one has to want to, one has to be interested in it. I think that people can, people get very motivated to make a dietary change if they're sick and they think it will help them. But for people who are not unwell but just want to be healthier, I think they have to educate themselves a little bit first. But I think nowadays, because the environmental question is so salient in people's minds, if people are convinced that it's better for the planet, that's, a very nice motivator. For people who are just dipping their toes in the water, maybe decide on one meal that they want to make whole food plant-based. Breakfast is very easy. Or one day a week to be whole food plant-based. Learn how to cook grains in bulk and beans in bulk and get a steamer, small steamer basket. That's my 4th favorite kitchen gadget. They cost, I don't know, $4 or something like that. But when I work with patients, it's very individual. So there are some people who come to me who love to cook, and they've come from a lifetime of cooking fancy things. It's learning how to substitute ingredients to make those same tastes that they want healthy. I have people who come to me also who literally don't know how to boil water, so it's quite individual.
That's my husband. If you give him a recipe to boil water, he might be okay. But
yeah, for someone who really, literally does not know how to boil water, the whole thing can be very daunting.
Yeah.
And when I consult with patients, I take the time to explain about simple changes that they can make. When the whole food plant-based idea started getting traction, there's been this explosion of very fancy whole food plant-based food, but it doesn't have to be fancy, and certainly not for every day. It doesn't have to be elaborate. It's very possible to prep your vegetables, cook your beans and grains in bulk, and be very, very, very simple.
I call it shop, chop, prep. So, because a lot of people on the weekends, or work during the week. So I say on the weekends, like Friday night, go shopping, go get grocery done. And then on Saturday, just prep the vegetables, wash them, dry them, get them ready. And then Sunday, spend a couple of hours in the kitchen. And that's what I do, is I get into the kitchen and prepare a bunch of things so that during the week, all I do is pull it out and heat it up. And
I think learning how to use a kitchen knife, learning how to chop. For some people, it's very daunting. As it happened, when I was a teenager, I worked in some restaurants, and I, actually learned how to use a chef knife very well. So I never chop things in advance. I like my salads, I like them totally fresh, but it doesn't take me long to chop things up. But if you don't know how to use a knife, a good quality knife, and use it safely, then it's going to take you longer to do it.
True.
So that's one skill I would say that is worth taking a little bit of time to learn.
I found Wusthof knives from Germany, and I really, really like those a lot. But do you have a favorite knife?
I'm not sure what brand I have in my drawer.
Okay.
I have a good knife for chopping, and then I have actually a bread knife that I use to cut pumpkins and things like that. I found that the bread knife with the serrations is very good for cutting those up, whereas the regular knife is not. It's not that easy.
And make sure they're
dangerous sharp. Oh yeah, of course, yeah, of course. Yeah.
Because a dull knife is it makes it so much more difficult to.
That's true. Yeah, that's true.
Well, Dr. Maisel, thank you so much for taking the time to be with me here today.
Well, thank you.
It's so interesting getting to know you and your journey. So thank you.
Thank you very much, Jean.